topic is to address the contemporary issues and the necessary changes to be done in the public health care in this disastrous and an unprecedented crisis of COVID-19. So the connectivity of this topic is globe, all the nations, not only India, not only United States, across the world. This topic has a nexus and a connectivity. So why I am organizing this program in the occasion of the 72nd Republic Day of India is India is also facing a lot of challenges in combating the COVID-19. And this 26th January is marking the 72nd Republic Day of India. India is the country which is upholding the great idea of unity in diversity. We have a lot of cultures, we have a lot of languages, we have a lot of states, many differences among us, but we are united together in everything, in welfare of the people, in national interest, to safeguard the countries, the culture, the tradition, the ethnicity, and at the same time in fighting the COVID-19 for the past 10 months. So India now has rolled out a world's largest vaccination drive. And India is the country which has initiated the world's largest lockdown during the time of COVID-19. So when this COVID-19 has created such a devastating situation across the world, it has made all the lives up and down, down and up. And this COVID-19 has shown very clear the inequality existing among the human beings. When the rich is able to access to the health care easily, why not the poor? Why not the downtrodden? Why not the weaker section? Why not the underprivileged? So why they were not able to have a good health care, the medical security, day-to-day livelihood, in order to win a one meal bread? They suffered during the time of the lockdown without employment. They were jobless. They don't had any opportunity to have a one-time food. It was a very challenging time in the life of the poor, the weaker section, downtrodden, underprivileged, and then the very poor, poverty line below people in India. So the public health care needs lot of reformation. This situation has taught us a great lesson to make a lot of changes in the public health care system, the medical security, the medical insurance, and everything related to the health care. Because in our Indian constitution, in the directive principles of state policy, the constitution guarantees health care to all, medical security to all, and it is a matter which is related to the right to life of a human being. That's the reason I selected this topic to be addressed in this international webinar. Swami Vivekananda says, the sign of vigor, the sign of health, the sign of life, the sign of hope, everything is there in the strength of the body. The strength of the body, the strength of the mind, the strength of the heart, the strength in the hand, everything decides the human destiny. This is the words of Swami Vivekananda. And Dr. APJ Abdul Kalam also said a lot about the health, the human development, the human resources, how it has to be accumulated and how it has to be focused on the national development and the national growth. So in this occasion, to mark the India's 72nd Republic Day, this international webinar is suitable, and this is the right event which will foresee our future and which will change the life of the poor, the weaker section, the downtrodden and the underprivileged. Because the right to life is the very important right of the Indian Constitution. So that's the reason I coined this topic for this international webinar. So this topic not only going to be addressed on the healthcare, at the same time, the human rights, the international human rights, what kind of a changes to be settled in the new world order, because this situation of the COVID crisis has united the world. The world has become a global village. India is sending hydrochloroquine to United States. India is sending medicines and Covaxin, the vaccination, to Brazil, and India has sent the labs, the testing labs to Iran, and India is helping many nations during this time of COVID crisis. At the same time, in quid pro quo, we are also extending our support, and we are getting the support from the other nations also. Now, America is facing a lot of challenges due to the COVID-19. At the same time, the new transition of power in the United States is taking a lot of steps and reforms and new actions in combating this deadly virus. So, through this, the entire world now have to set a new model, a new agenda, a new objective, a new world order to serve the humanity as a whole, to serve all the people across the world without any discrimination, without any inequality, without any differences. We all has to be united. That's the reason I decided this topic, I coined this topic, and I proposed this international webinar. Now, I have given a brief introduction about the objective of this international webinar. And now, the very, very important thing, our chief guest and our speaker. I thank Dr. Ingrid Vasiliev-Feltes for accepting my invitation immediately in the midst of her busy schedule. She is a great scholar. She is a CEO and founder of SEI Institute. And she is also a founder of various other institutions. And she is a part of GBA. And she is such an intellectual, such an eminent, and such a versatile international genius. I have gone through her profile. She has done various contributions in various fields: the healthcare, economics, governance, and various human development activities, academics, research, and various other contributions. So I decided this international topic, this topic of the necessity of humanity, this topic of setting a new world order have to be addressed by such a genius, such a great personality. So I thank Madam wholeheartedly for accepting my invitation immediately as soon as I proposed this event, this topic, without any hesitance. I thank you so much, ma'am, from the bottom of my heart for accepting my invitation. And now it is early morning in United States, morning 6 a.m. Ma'am has joined us in the early morning. Today in India, now it is evening. So I extend good evening to all our friends in India, and a pleasant, blissful morning to all our friends and Madam at United States. So through this event, Ma'am will be addressing on this topic in depth through her mesmerizing speech and through her well-researched PowerPoint presentation. And Madam will be throwing lights on the topic, and I strongly believe this session will be an eye-opener for the new world order, which is going to serve the humanity, which is going to serve the mankind, which is going to cure the disease, and which is going to be a blessing to the poor, weaker section, downtrodden and underprivileged, and those who are voiceless. So I sincerely thank ma'am, and I invite ma'am to deliver the address and the lecture on the topic, the global healthcare in COVID-19 and the international human rights. My tributes and welcome to Madam. Welcome you, ma'am.
Thank you so much for inviting me. And also, I would like to extend my thanks for the very kind introduction. I will do my best to provide the audience with scientific insights. I've done a lot of research for this presentation, and I would just like to highlight that all, of course, opinions are my personal. I do not represent any official body for today during our presentation. Because you already mentioned it, I would like to also highlight that throughout my career, I've always been a passionate advocate for education and highlighting a balanced approach so that the public is informed. So throughout the presentation today, I'm going to try to highlight all possible perspectives as a scientist and as an ethicist. You didn't have a chance to highlight that, but I'm also the chief ethics officer for the Government Blockchain Association, which has more than 90 chapters around the world. So I do have the opportunity to interact with a lot of colleagues around the globe through many of my not-for-profit endeavors. And that is very helpful for our presentation today because I have the opportunity to interact with scientists and colleagues across the world that have been going through these challenging times and trying to answer some of the questions that you highlighted already. If it's okay, I would love to share presentation so that we can have a few of the facts. Please let me know if you cannot see the screen. During the presentation today, I wanted to first focus a little bit on some global pandemic trends to make sure that all of us have the facts that are lately published. As of yesterday, actually, I made sure that I collected the latest statistics. Then I will highlight a few of the global challenges specifically related to the human rights that have been identified by scholars across the globe and the challenges we face from a public health perspective. Towards the end, I'll also highlight a few of the ethical considerations because I do believe that ethics, human rights, and public health are very closely related, and we need to address some of those elements as well. And then at the end, I will make a few suggestions that I do believe as a global society we could maybe engage in so that we can be more prepared for future pandemics. This is just as of yesterday from Statista. It highlights the number of COVID-19 cases worldwide. As you can see, it's a staggering amount. The number of deaths is listed right below, 2 million plus, and the estimated mean infection rate is 2.5. This is also from Statista as of January 22nd. This highlights the total number of cases in raw format. And as you can see, in the world, we're at 98 million already. And then in descending order, right after USA, you have India, Brazil, Russia, UK. It's also interesting to note the distribution of the COVID-19 cases in select countries worldwide as of January 18. Again, in terms of a proportion here, the previous slide highlighted all the cases in terms of numerical value. The proportion is important when you take account the size of countries, right? So it's crucial to observe again that United States and India are at the top, no matter how we count. This chart highlights the number of coronavirus drugs and vaccines in development worldwide as of January 22nd. You will also note that they are categorized by phase because when we develop vaccines worldwide, each vaccine has to follow a specific phase of development. And compared to prior to this pandemic, we have accelerated these phases tremendously, and all the governments and international organizations have facilitated the approval of vaccines at a much faster pace than we have ever done as a scientific community. However, you still have to pass through some of these, even though at an accelerated phase. So as you can see, in preclinical phase, which means just scientific in the scientific lab for our audience, we have about 664 in development worldwide. And then as you advance through the other stages, as you can see, you keep having less and less and less. So there's a lot of work up front, and then very few make it through the final stage for approval and usage. This is a chart that highlights what we're dealing with from a public health perspective globally. Although we've been talking only about the pandemic, which you can see at the bottom of the chart in a highlighted red where it says COVID-19, and it's been consuming us as a society completely from an economic, social, cultural, and health perspective. I would like to highlight that there are many other conditions still going on that we've always been dealing with. And unfortunately, not only are we having a challenge with the pandemic, but we're also neglecting all the other conditions and all the other reasons that are affecting our global population. So that's one element that I've been talking consistently since the pandemic started, that I wish we were better prepared for this pandemic so that we can address also all the ongoing chronic diseases and all the other infectious diseases and all other diseases that we've been struggling with for many years. Because I will highlight this a little bit later during our presentation, that the health systems have been so stressed that not only have we not been able to control the pandemic and take care of the very sick from an infectious disease perspective, but all other chronic diseases are getting worse as well because no one has the time or the resources to appropriately approach them and manage them. This chart also highlights from a socioeconomic and socio-demographic perspective the percentage of population that has died by age groups. And as you can see, there's a very high proportion after age 50 that is unaffected, unfortunately. This chart highlights globally the types of strains from a COVID perspective that we're dealing with. And this is very important when we're going to talk about travel restrictions and any other emergency response measures, because I will show that unfortunately the COVID virus is part of a very large family of viruses. And since the beginning of the pandemic, which you can follow in the left corner of the chart, it has developed into multiple other genomic variants. So all these little colorful bubbles that you can see are new strains of the virus. And this is very important because we as a scientific community need to constantly monitor these strains. As some of you might know, just a few weeks ago, there were at least three new strains identified worldwide, and it's very possible that many others are out there that are more infectious as well. So the scientific community has to monitor all these little variants to make sure that none of them becomes even more infectious or develops new type of traits that will require new vaccines. For now, all the vaccines that have been developed seem to cover the new strains as well, but it's too early to state. Because we're talking about vaccines, I also wanted to highlight this chart, which shows how much each of the countries have invested in purchasing vaccines. And you can see the distribution at the bottom of the chart. You have India at 20.7%, the European Union 21.9%, the United States at 13.9%. This is also, just as of January 22nd, the percentage of population vaccinated against COVID. And you can see this is a very different chart compared to the countries affected. So there's unfortunately an inverse correlation between the countries that have done much better at vaccinating their population, where Israel does extremely well compared to everybody else. And then unfortunately, as we've shown, the countries that have very high rates, such as US, have been struggling. And I'll highlight some of those things in a second. So now that I just gave a very brief scientific overview to make sure that we have the facts that I'm going to address, I wanted to highlight the global impact of the pandemic, again, from a public health and from a human rights perspective. There are many other economic facts that I will not mention during the presentation because they're beyond our scope. However, of course, we all know that there has been a tremendous impact on the global economy and on the socioeconomic factors that are related to that, such as education and access to basic needs. Overall, there has been a drop in global GDP for 2020. Depending on the source, it varies, but most sources hover around 4.5% drop in global GDP. The expected global GDP loss is estimated to last until 2022. So although the sources vary, there is no official source that feels we can recuperate completely, at least to be back at the baseline level before 2022. We all know that we're facing global unemployment at massive rates, academic delays due to lack of schooling in many countries where children were not able to be in a school environment, and therefore at home they might have not been able to have access to virtual education. Worsening of routine healthcare prevention, like I highlighted before, worsening of chronic medical conditions such as chronic blood pressure, diabetes, Alzheimer, autism, many other conditions that we're struggling with as a society. And of course, worsening of access to care due to the burdened healthcare systems. Many patients have been trying to go to their routine appointments and were not able to because the healthcare systems worldwide are absolutely burdened and overwhelmed with taking care of the pandemic patients. I've not listed it, but I would like to highlight that even just as recently as last week, I was informed in one of my daily meetings that the morgues have not been able to pick up patients that have deceased from hospitals because they were full. So that's heartbreaking as a society and as a scientific community that we're at the stage where the morgue has no more space to accommodate deceased patients. So it really broke my heart. What are some of the public health trends that we've been noticing? Across the globe, regardless of the country, there have been elements of each of these trends. Yes, there are some countries who have been able to manage this better, others less. There have been also waves. The various countries have done much better during certain stages of the pandemic, such as in Europe, for instance, we had several months where the restrictions were more in effect and the numbers had gone down. However, as the governments made decisions to restrict some of those very drastic measures, unfortunately, then they had a recurrence of the pandemic wave. So overall, we notice a lack of adequate protective equipment for medical staff across the globe, lack of adequate screening tests available for everybody when needed, lack of adequate treatment by risk categories, lack of medical supplies allocation, lack of appropriate medical monitoring post-treatment, lack of appropriate vaccine distribution. Next, I would like to highlight the legal and medical publication highlights that I've noticed. I've done a meta-analysis of many scholarly publications in the medical and legal field, and it shows a summary of the following elements. Every single scholarly publication highlights that most countries, again, more or less, have struggled with adequate public health responses, with lack of public health education, opportunities, and alternatives during this pandemic, poor alignment with human rights in many countries, chaotic, reactive, and at times delayed public health responses, poor reinforcement of guidelines, and lack of guidelines clarity, meaning that you would have different stakeholders making conflicting guideline statements, and therefore the public was completely confused. The World Health Organization, as we know, has 196 member states, and it sets forth the international health regulations. And I would like to point out that it aims to reduce spread of disease while minimizing disruptions to travel and trade and respecting the dignity, human rights, and fundamental freedoms of persons during public health crisis. If we look even at this definition, we have failed during this pandemic, and I would hope that we will be much better prepared for the next one. The regional statutes in each country have constitutional provisions to allow for human rights derogations or limitations in types of public health or national emergency. International law, and in certain cases constitutional law, indicates necessary, proportionate, and reasonable interventions related to legitimate public needs. So the problem is globally that how do we define necessary, how do we define proportionate, and how do we define reasonable? That has been the challenge. So I think what we've learned is that legal communities and scientific communities have to come together and advise governments and policymakers on how to maybe refine some of these definitions so that they're much more accurate and clear and that allow much better reinforcement. United Nations, as we know, has declared a global health emergency during this pandemic. A little late, but at least when they did, it also did not get accompanied with appropriate strategic implementation guidelines. As a matter of fact, the first strategic response was published in April and then another one in August. And since then, we have not had a revision. So that again shows that the current modus operandi, the way we're handling this is not optimized. And I hope that for the next pandemic, we will have a much better global humanitarian response plan in place that is nimble, adaptable, and can quickly be deployed across the globe. So one of the ways the United Nations categorizes the public health measures is by action domain. And I wanted to highlight that for each of these domains, how do you mobilize forces? How do you control the pandemic response? How do you suppress infection spread? How do you reduce mortality? And how do you develop effective measures? In every single one of these domains, unfortunately, we have failed on a global level. We could have done better at all of them. And there are opportunities for improvement, even in countries that did much better than others. They still have a lot of lessons learned, and they are all working on preparing better for the next pandemics. There's also a way to categorize public health measures by approach, and specifically individual, by community, government approach, private companies, international organizations, and academia. Again, if we even go by this category, we definitely have failed individuals across the globe. As communities, we have certain very few communities where we have done better, but definitely there's room for improvement even in countries like New Zealand, who have managed it very well. Private companies have also had a very hard time during this pandemic with chaotic responses and a complete lack of cohesiveness. And then international organizations have come together at a certain point during the pandemic, specifically for the vaccine developments, but we wish that this would have happened way earlier. And then academia, same thing. I think we see a global effort for more collaboration and increased coordination of efforts from a scientific community to try to address this pandemic. But again, I think everybody concurs that there is tremendous room for improvement. So now let's talk about the human rights challenges. Same thing, I reviewed multiple articles published in several publications that are all scholarly publications, and there's consensus amongst everybody that the emergency pandemic response caused constraints on individual freedom, on social rights, economic rights, and on global solidarity. And governments have had a very difficult time balancing all these elements. What are some of the main balances of state roles? They have to balance human rights from an individual and societal perspective, which is usually the major challenge. They have to manage all the elements of public health, food supply, medical supplies, and any other types of supplies for basic needs, and sanitation. And again, when we look at all the statistics published across the world, every country, even those that manage this very well, all have published that they could have done much better because nothing they had in their crisis response really prepared them thoroughly and appropriately to manage and to be able to keep a good balance between human rights and the public health response. So how can we balance the present and the future? Yes, we have a right to life. We have a right to health. We also have a right to choose death. But how do you allow each individual to make these choices without affecting the society as a whole? And that I think we can all do better as a global society. We also have a right to a livelihood. So quality of life is extremely important beyond just life or death. And the freedom that we all perceive at a personal or societal level, right? Because depending on the cultural aspects and the geographic regions, all these elements, life, health, death, livelihood, or freedom are perceived very differently. If you ask different socio-demographic population subsets also, what does a good quality of life mean if you want to live? You get a very different answer if you live in Germany, or if you live in India, or if you live in Japan, or if you live in the United States. And yet again, in all those elements, we're not prepared and we haven't done a good job as a society. There's tremendous room for improvement. So after the crisis has subsided, it is a strong recommendation from the scientific community to do a collaborative effort to try to enhance some of these response measures during the next pandemic. We also have a duty to enable sociocultural recovery and economic recovery. And again, how do you balance those for the good of the individual versus the good of society? As we know, I wanted to highlight a few of very specific elements that were challenging by a few of the articles listed in the human rights. So Article 1, as we know, all human beings are born free and equal in dignity and rights, and they're endowed with reason and conscience and should act towards one another in a spirit of brotherhood. The problem is when we try in a pandemic to deal with prevention and screening of disease, access to medical care, access to treatment, access to support systems, and choice of surveillance, we're failing miserably at upholding Article 1. Article 2, same thing. When we have technologies that we have all deployed massively at a global scale, unfortunately, we fall into a very dangerous trap of having algorithm bias. And as you might know, there are many publications, scientific ones, that have highlighted the fact that, yes, technology advances can help us a lot, but we have to be very careful to make sure that we're not, in an attempt to control disease, actually violate Article 2. So specifically, population selection bias is a very common one. In a desire to control some of the high-risk populations, we might inadvertently induce bias into the system, and then malicious intent of that data gathered can cause even further consequences for years to come. So balancing the public health or medical optimal choices versus risk of discrimination is something we need to be very careful about. And I dedicate quite a lot of time in my role as Chief Ethics Officer for blockchain deployments globally into this. And I also work with an organization that focuses on artificial intelligence deployments across the world, which is also affiliated with the United Nations. And that's one of my very, very important elements that I always emphasize and work with groups across the world. For Article 3, everyone has the right to life, liberty, and security. Again, when we had the severe lockdowns, as anybody can understand, we did not uphold Article 3, but it was a very difficult decision for a lot of governments, right? And how do you allow everybody to refuse treatment but not put society at risk? How do you prioritize care? Do you prioritize medical personnel? Do you prioritize elderly who are at high risk? Do you prioritize children? Do you prioritize diseases that can be saved and cured? Do you prioritize cancers? It's very difficult. And there are, again, multiple opinions on this, depending on the society norms. And then, of course, prioritization of supplies or equipment. Very early in the pandemic, we had a very big shortage of protective equipment for medical personnel and ventilation devices. As we know, many companies had to actually convert all kinds of other technologies to make more ventilators. And I was personally involved in many cases where physicians had to make the tough ethical decision whom to save because there weren't enough ventilators, or they had to actually take a patient off a ventilator to save another patient, which is terrible from a human rights perspective and ethics perspective and medical perspective. Article 12, as we know, when we engage in public surveillance, employee surveillance, and mandatory reporting of positive testing, again, you can see how we violate Article 12 in an effort to control the pandemic. So again, when we come out of lockdowns now and have to return to a work environment, this will be a major, major problem because there's no perfect guideline and there's no easy way to do this without causing some stress in the system between individual employee needs and society and organizational needs. Article 13, 20 and 27, again, during mandatory lockdowns and mandatory quarantines, we absolutely violated majority of these as on a global scale. But again, in order to manage the public health crisis, governments and organizations had to make a tough decision. We just wish that they were a little bit more proactive and a little bit more balanced in their approach and a little bit more timely and educate the public, because I think that's another important element. Communication has been suboptimal at a global level during the pandemic. It's very important to educate the public why we have to do something and what were the careful considerations that we had to take. And I think we could have done much better as a society. Article 26, again, education has been the other unspoken pandemic, so to speak. I know we focus a lot on human rights and economy, but I always worry about education very much, because that is one that's going to affect us for the next 25 years, the children that now had a big gap in their educational experience. So again, the global trends in managing this pandemic, I would say we had incongruence, incoherence, and inconsistency for educational systems, how they managed it across the world. You can see a complete chaos and returning back to school, returning back to lockdown. So it's not a very good environment from an educational perspective for children across the world. Then the regional trends, lack of educational resources, as we know in many areas of the world, conflicting messaging by public health officials versus government officials versus education officials, misalignment between public health requirements versus educational needs. So that all has affected children across the world. We're getting close to the end, but I just wanted to highlight the ethical principles. And it's really important when you superimpose these on all the human rights elements, you can see why we're dealing with at a global level with such crisis. Beneficence, maleficence, autonomy, justice, efficiency, proportionality, health and wellness maximization. If we go over all the elements during this pandemic, when we aimed to do well to help all patients, we have not been able to help all patients. Maleficence, unfortunately, there have been forces around the world. Cybersecurity is a great example, who have used this crisis to increase their attacks on some of our technology resources, right? And which have stressed the society even further on top of everything else we're dealing with. Autonomy for humans and for governments and for institutions and companies has also not been upheld. Justice, as we highlighted throughout, it's been very difficult to show justice towards everybody in this world. There are populations that have been much more affected during this pandemic, although in theory, we should have been able to allow everybody equal access to care and everybody equal access to education, everybody equal access to the types of basic needs we need during a health pandemic like this one. And then efficiency, same thing. We have not been able at a global level to uphold the principle of efficiency or proportionality, right? So to make sure that we allocate resources proportionally to what was going on. And then health and wellness maximization, I think we all agree that we really failed at this one. So again, I know it's not an ethics talk, but I felt the urge to mention these because I think they're very closely related to human rights and public health. So to summarize, I call it the ethics of pandemics for everybody to remember. Access to care has been affected, resource allocation, and when we talk resource, it's medical treatment, protective equipment, testing supplies, vaccines. As we know, everybody wants the vaccine now. Unfortunately, as we've seen in the charts at the beginning of our presentation, there are not enough vaccines distributed already, and logistics have been a nightmare. Most governments are not prepared to deliver vaccines to everybody in a timely fashion, even if they were available tomorrow morning and cost was not an issue. Screening, surveillance, prioritization of care and treatment, balancing needs and protection of individual versus society, addressing high-risk populations versus all citizens are all issues that affect human rights and ethics. Again, for the future, my recommendation, based on all the reviews from many scholars, I just put them all on one slide for our audience. We need to have a proactive global healthcare governance. Just silos are not going to work when we have a pandemic. it's really important to get out of this siloed thinking. And the same way like some institutions came together to work on vaccines and share knowledge, we have to do that for global healthcare governance so that resources can be allocated dynamically where there is need in the world, as opposed to just this mismatch and misalignment between resources and need. A proactive global healthcare supply management system. Again, there are people across the world that work in logistics and supply chain management, and they want to do a better job at handling healthcare supplies the same way like Amazon, as an example, handles shipping of other goods, right? They have shown that for healthcare, we were absolutely not equipped to quickly adjust to something of this scale, versus companies like Amazon were able to handle it much better. So we need to mirror and learn from this experience and adjust for healthcare supply management so that if we ever are in this situation again, we can deliver ventilators where they're needed and masks where they're needed and vaccines and tests and medications to the countries or cities or citizens that need it most, when they need it most. And then a proactive global precision medicine data exchange. And I'll explain for our audience that might not be familiar with the term precision medicine. It's the modern medicine that is based on using genomics, which is our genetic data, to inform medical science. And that allows us to develop customized treatments for individuals as opposed to just what works for a population at large. So if the whole society globally would share the knowledge that's necessary to advance and accelerate our quest to control pandemics, we could do much better at preventing future pandemics and managing future pandemics, because it's very likely that a virus might emerge tomorrow, a new one. So it's really essential that scientists across the world can share data and work together towards that. And last but not least, and this is my last comment before we can take questions, we need to have a global healthcare pandemic response system. We have the technologies available. We can manage much more complicated things where we have invested efforts and dedicated ourselves as a global society, such as space travel is a great example. I think it is unacceptable for us with the technology we have and the scientific collective brain power in the world that we have not been able to have a more modern, nimble, dynamic response system that would enable us to balance human rights and public health much better. So I will conclude my presentation for this, and I'm hoping to answer a few questions, but before I finish, wanted to thank you again for inviting me and for sharing some of these thoughts. It's a big topic, but I hope that at least we shed some light on the elements that we all need to work together to address human rights and pandemic responses. Thank you again for the opportunity to share a few of these findings. So if there are any questions, I'll be happy to answer a few. I think you're on mute.
I think he got a call. I saw his audio is not audible.
We can hear you now.
Abhi, you, leave the meeting and join again. I think you may have got any technical issues. Leave the meeting and join again. Your voice is not audible, Abhi. Not audible. Leave the meeting and join again. Abhi.
Yeah, it's okay.
I think Zoom has some technical issues.
No problem. No problem. Well, we'll be happy if the audience has questions to entertain. In the meantime, I just wanted to highlight that all data shown were infographics from Statista, and there was a highlight of all the scholarly publications that are published in academic journals. Here he is again.
Abhi, now?
Are you able to hear us now?
Now, can you hear me?
Yes, we can hear you well now. Welcome back.
Yes. Thank you, ma'am, for the wonderful, very informative session. It was very, very insightful. I request the participants to kindly post your questions in the chat box so that I can read it to ma'am, and ma'am will be answering for your questions. So the YouTube live questions also I am monitoring in my laptop. So those who post questions in the YouTube live comment box, that question also will be read to ma'am and it will be answered. Participants, any questions you can post it in the chat box. Okay. Okay, participants, you can send your questions to my foundation mail ID, castrolexidufoundation@gmail.com. So I will send the questions to ma'am and ma'am will be responding to the questions via mail to me and I will make the answers to reach you all. Ma'am, I have some questions.
Please.
What is your views on the clinical trials? Before rolling out the vaccinations, we need to undergo a very, very strict clinical trials so that the people will get hope on the vaccination. So what is your views on the implementation and checking the scientific process of the clinical trials? And what is your views on this?
Well, as someone that was in charge of research for 11 years in academia, I can really speak to that. So the traditional length of time that we used to develop vaccines was way longer than now because we used to have at least 2 years of safety monitoring before we could release vaccines. So our time to monitor response of the population to vaccines was way longer. Not only the time to develop vaccines, but this time due to the pandemic, they approved emergency use. And my view is the following. If used appropriately for the high risk populations and with informed consent, that's the key in this. That's why ethics and human rights are so important. As long as you have informed consent and appropriate education so that the population understands and it's truly informed consent, not just assent. I think for the high risk populations, emergency use is appropriate. And the high risk populations as defined by the medical community are those patients that have specific chronic diseases that pose them at higher risk because the risk of not doing anything outweighs the risk potentially caused by a vaccine that can cause some negative consequences that we never had a chance to address. However, the ethics of emergency use for populations that are not high risk are a little tougher to balance. And as you'll notice in a lot of the ethics publications, the society is split on that. I do feel from an ethics perspective that forcing vaccines is very difficult. But I also believe that from a public health and human rights perspective, in controlling the society and helping our society, we need to carefully balance the employment part of it. So for instance, if as an individual, I don't have high risk and I, with informed consent, choose to not have a vaccine, it's going to be very difficult from a human rights perspective to force anybody to have it. However, if I want to go in a public space to work, there I will have to abide by that. And we have precedent for that, right? Healthcare providers are not able to work in a hospital if they're not vaccinated for any vaccine, forget the pandemic. So if we mirror what has been done for many, many years across the world with other vaccines to eradicate other infectious diseases, I think we're gonna do a better job at managing the employment part and how we can handle that. I think on a personal level, it's going to mirror what we do with schools, right? The way we vaccinate children to be in school, but then we allow parents and medical professionals to weigh the benefits and the risks on an individual level. So overall, my answer is for emergency response for the high risk populations and with informed consent, I think we had to.
Ma'am, I have another question. In India, now we have rolled out the world's largest vaccination drive in India. So the government is giving an option. If you are interested to take the vaccine, you can come forward and you can take the vaccine. And they did not make this vaccination mandatory to the citizens. And the minuscule group of people, because India is the world's largest populated country, we have 130 crore plus population in our nation. So government is giving an option to the people, point number one. Point number two, in the first rollout, the first part of the rollout of the vaccination drive, they are targeting a certain number of people. So whether this will be risky, making the vaccination mandatory will be good, or making the vaccination optional will be risky. What is your views on this?
Well, again, from a medical and ethics perspective, and there are thousands of publications on this for the many past 100 years, but my personal view is that it's a balance, because again, if you're a high-risk medical professional or a high-risk other employee, such as people that work in the ancillary professions where they have very high contact with disease, right? Not everybody is a medical professional, but they might work in a hospital for many other reasons. So if you're a high-risk population from a employment perspective, I think we have examples in many countries around the world where it works better for the good of society if you do mandate those. Same way, I do think that mandating people that work in education, right, that are exposed to a lot of population, each teacher, if they're not vaccinated, they can spread disease to many others. So educational professionals, medical professionals, high risk, other employments where having disease can cause catastrophic consequences, such as nuclear energy, let's say, right? That's a great example also. Pharmacy personnel, laboratory personnel, a lot of examples where if the population is high risk, we have examples where mandating that and being able to opt out would mean that you also don't go to work, I think is one solution. Now, not everybody agrees to that, but I think we have many governments that have managed it like that, that there's a balanced approach for high risk population, and they can be high risk medically or high risk from an employment perspective for society.
Yes, ma'am. Ma'am, my last question is, as you spoke about the proactive global healthcare governance, in across the world, as you said, everybody, justice cannot be done. But at the same time, it's our duty to serve everybody. As a human being, I have to serve all the humankind. I have to serve all the mankind. I should not see any kind of disparity or differences. But one thing, across the world, there is a global inequality because we have superpowers, developed nation, developing nation, poor countries, and very, very underprivileged nations. So how this proactive global healthcare governance, because without the consensus, cooperation, support of all the nations, this cannot come into force in the new world order. So what is your views? What are the steps must be taken to achieve this proactive global healthcare governance with this kind of prevailing inequality among the world, across the world?
Yeah. Of course, it's a big question, but I'll try in 2 minutes to give you my perspective on this, because I've dedicated a lot of time thinking and talking about this topic. But I do believe we have other examples where with global stakeholder approach, multi-stakeholder approach, we have been able to find solutions. So the short answer is we need to think about this as a global healthcare ecosystem. And how do you maintain that ecosystem? And we all live in that ecosystem, so we need to identify the priorities that need to belong in this global governance. Not everything needs to be global and not everything needs to be governed in this ecosystem, but there are certain elements that would need to be part of that, right? And one example is healthcare passports. That has been, I recently had the opportunity to go to the European Union, and we had a big group of 75 experts talking about this, right? So being able to solve our travel for long-term from a healthcare perspective and public health perspective is one example that maybe many stakeholders can come together, because it affects all of us. So if we want to solve that, we have to put differences aside and solve it. That's one example. The second one is, like we did with the vaccines, many organizations were able to layer their approach and still protect their patents and protect their secrets and protect their company revenue, but they also were able to allow knowledge sharing so that we can expedite this vaccine development. And you saw, because they broke those silos and they had this global approach, we were able to have a vaccine in a matter of several months instead of years, right? So I do think the same way, if we look at other industries, the way we've managed global governance, right? You can pay with a credit card everywhere you go in the world. So the same way we handle digital payments and you can use a credit card wherever you go in the world to buy something. The same way, if we think like that you need to be able to have a global healthcare governance because it's to everybody's benefit, we need to identify those key pain points that we want to solve, and then it can. But everybody has to agree at least on what are the 2-3 things that would make a big difference if we want to manage the next pandemic better. And access to medical supply is a very obvious one, right? There should not be any silos, and we should have the capacity to have masks and gloves and protective equipment for a medical professional anywhere. There should not be anybody that has to use a cloth as a medical professional for protecting themselves in this era, right? So, or testing. That's another great example where we can all come together from a global healthcare perspective and governance perspective. So I do believe a layered, structured approach, breaking silos and identifying few things. It can't be that everything will be shared. That's not feasible. But there are certain layered, stratified approaches that we can all agree on and that have been done in other industries where we work together and it's working fine. So we need to take those lessons and apply them to healthcare. That's my perspective.
Thank you, ma'am, for your responses and for your wonderful answers. And it was a very, very informative session and such a beautiful and perfect presentation you are prepared for this event, and really such a wonderful way you have addressed the topic of this international webinar. Thank you so much, ma'am, for joining us in the midst of your busy schedule in the early morning in the United States. Thank you so much. In the future also, we seek your support, we seek your guidance, we seek your advice in all our future endeavors. You're always with us and you will be in board with us for all the future initiatives also. I wholeheartedly, from the bottom of my heart, I thank you, ma'am. Thank you so much for this great support, for this wonderful lecture to mark the 72nd Republic Day of India.
Thank you for your leadership and your advocacy. You're doing wonderful work with your foundation. So thank you for what you do.
Thank you so much, ma'am. And before concluding this international webinar, Swami Vivekananda says, I don't have any belief on religion or God who is not wiping the tears of the poor, who is not giving a piece of bread to the poor who is hunger. And Swami Vivekananda also says, strengthen your body. If you are feeling weak, you will be weak. If you feel your strength, you will be strength. And Swami Vivekananda also says, without strength in the body, you can't achieve your goals. So he always emphasizes and stresses on this point to make the body more and more strength. So there's also a proverb in India, we used to say, without wall you can't paint. So without body you can't achieve your goals, you can't achieve your destiny, you can't reach the purpose of your birth. So this pandemic has been a great challenge, taking many lives in the past, in the last year, 2020. And this 2021 is a new beginning to the entire humanity. We are combating this deadly virus and moving forward and marching forward to achieve in the days to come, which was discussed by Madam, the proactive global healthcare governance, which is going to serve the entire humanity and mankind. And this international webinar is just a simple and a small efforts from my capability, whatever I can, from my level best, whatever I can. I have organized this so that in the future, this international webinar videos, all my foundation activities and all our webinars and the competitions and the inaugural ceremonies and various other programs are uploaded in our foundation and my official YouTube channel. It is uploaded there because in the future, anybody may search on this topic and they may get the insightful address of Madam and they may work for the welfare of the humanity. We are not worried about the participants. We are not worried about the numbers or members. we are worried about the humanity. So anytime anybody can watch these videos are accessible in the YouTube. Anytime they can watch and they can take the lessons and they can work hard in the reality through dynamic action, as Swami Vivekananda says, and serve this mankind. That is the main objective we are organizing these kind of programs. So I request through this international webinar to all the participants to strengthen your body, keep your body fit, and eat nutritious food, immunity boosting food in this COVID-19 pandemic. India is rich in Ayurveda, the traditional healthcare, and we have allopathy, homeopathy, Ayurvedic, Ayushman, and various other traditional healthcare, Mooligai, and then the resources, the natural resources from the forest, Himalayas, and we have a lot of medical medicines, the medical rich Ayurvedic medicines in India. So I request all the Indians, I request all the peoples across the world to take care of their health during these kind of unprecedented crisis of pandemics. That is very, very important. At the same time, we all must care and help and support those who are not able to afford the basic health care. One-time meal. Those who are hunger, we have to feed the hunger. We have to take care of our fellow human beings. That kind of thought and mentality we human beings must grow through these kind of nature lessons like pandemics. And through this program, I take immense pleasure to pay tributes to Dr. Shanta. Dr. Shanta is an Indian oncologist who dedicated her life for the welfare of the cancer patients by establishing, this is photo of Dr. Shanta ma'am. She is an Indian oncologist who dedicated her life for the welfare of the cancer patients by setting up and establishing a cancer institute in Adayar, Chennai. And she served a lot of cancer patients, poor cancer patients with affordable rates. Sometimes she used to take care of a lot of medical awareness programs, and she used to heal and cure the cancer patients without charging, and she is such a symbol of humanity. Last week, Dr. Shanta ma'am passed away, and this event is a great tribute to such a great personality and a great human being who dedicated her life selfless to the welfare of the mankind. And she is such a great personality. She received Padma Vibhushan award from the government of India, and her loss is an irreparable loss to the mankind. So through this initiative, through this international webinar, I myself and we all pay our tributes to Dr. Shanta ma'am. May her soul rest in peace. So like this, I request those who are in the area of healthcare, nutrition, hospitality, they have to live like Shanta ma'am, and they have to dedicate themselves to their work and render a selfless service to the humanity. This is very, very important. So with these words, I pay my tributes to Dr. Shanta ma'am, a great soul, and I urge and request all to take care of your health in this situation of pandemics, and may the world with unity let us achieve the peace, harmony, and eternal happiness, healthy life, prosperity, and success in the future endeavors. Thank you so much for all joining this international webinar. I thank our chief guest and speaker, Dr. Ingrid Vasiliou-Feltes ma'am, for joining us for this international webinar. Thank you all. Jai Hind, Jai Bharat. Thank you, ma'am. Thank you all.